Senator from Nebraska Ben Nelson helping pass the Senate version of the health care bill, but some say that's only because he got his state some major kickbacks for federal funding for Medicaid expansion. Ryan.
South Carolina Senator Lindsey Graham now calling for an investigation into that deal. He joins us right now from Washington, D.C. Welcome back, Senator.
Good morning.
Hey, Senator, I know it's been tough times for the minority in the Senate these days, but one thing where you put the line in the sand, and that was when you heard about the deal that Senator Ben Nelson got for the state of Nebraska. Legally, you think he's in trouble there?
Well, legally, I think other states can make a constitutional challenge. Let's let our viewers know what we're talking about here. They needed 60 votes. Ben Nelson was a holdout. Instead of negotiating on C-SPAN and bringing about transparency that was promised in 2008, we wind up getting one senator in a room where no one else knows what's going on other than Reed and Ben Nelson, and it goes sort of like this. What do you need, Ben, for this last vote? Well, I tell you what, Medicaid's expanding under this bill for everybody in the country. It's $1 billion increase for the people of South Carolina. Ben, what would happen if we let Nebraska expand their Medicaid enrollment and the federal government paid for it? Done. So I think that's just incredibly inappropriate. That's not change we can believe in. That is the worst in politics. And this bill has no Republican support for one reason. If it becomes law, almost 80% of the people in the country will be under some form of government health care.
Senator, isn't bribery what politics is all about? I mean, I don't mean to put you on the spot, but have you ever accepted any kind of a sweetener deal for something for your state?
I try to advocate for the state of South Carolina, but I also try to make sure my country is doing okay, too. My country means more to me than anything else when it comes to being a senator from South Carolina. It's not fair for my country to do this to its fellow citizens. It's not fair to raise $518 billion in taxes when we're in the middle of a recession. It's not fair to cut Medicare by $470 billion and start a new government program. It's not fair to squeeze out private health care. It's not fair to give a deal to the people of Nebraska to get one senator's vote and not share that deal with the rest of the country.
I understand that, Senator.
That's not good politics.
I totally understand that.
That's not normal politics.
But what I'm asking is whether or not bribery is the way politics work on Capitol Hill.
In my view, no. It's not the way that I don't think most senators believe this is okay. And if it is, just say so. I'm on your show. I think it stinks. I think it's sleazy. Now, if you disagree with me, you think it's good politics, come on some show and say it's okay with you. Go back to your state and tell the people in your state, our Medicaid bills are going to go up, your taxes are going to go up, but we had to do this to get Nebraska on board. Is that okay with you? Do you think that's fair? I hope they get laughed out of the room.
Senator, you've been in the Senate for a number of years now. Have you ever seen anything of this scope jammed through with such a win at any cost dictum to it?
Absolutely not. Medicare passed with 79 votes. Social Security passed with 94 votes. The Americans with Disabilities Act passed with over 90 votes. I've never seen in my time in politics an effort by one party to jam the other party and change 1/6 of the economy and not be able to get one Republican on board. I will put my bipartisan credentials up against anybody. I've been in the gang of 14. I worked on immigration. I voted for Sotomayor. They have not reached out to any Republican in a meaningful way because at the end of the day, their goal is to get more people covered by the government. We go from 60% of Americans in government-run health care to 80% of Americans in government-run health care, and no Republican is going to vote for that, including Lindsey Graham or Olympia Snowe.
Senator, you look steamed.
You
look really ticked off.
Well, I mean, we're up here to run a country. We're up here to help people. I want to expand coverage. I want to do away with pre-existing illness exclusions. I don't want to run up the debt that's beyond the ability of the next generation to pay. I don't want to become Europe when it comes to health care. And it is frustrating to have an amendment filed on Saturday, 400 pages, and the tree be filled so you could not amend the amendment. It's frustrating to have a 2,500-page bill jammed through the Senate the day before Christmas and be shut out of the process. This is not going to help this country solve health care. And if you have your private health care today, your premiums are going to go up and you're going to be crowded out of the market and you'll eventually be in a government-run health care plan.
Ho, ho, hold everything. All right, Lindsey Graham joining us today from Capitol Hill. Thank you, sir, for taking time out of your busy schedule to be with us.
Merry Christmas.
Merry Christmas to you, too.
Thank you.
Some other